So basically, a quality control sample is of known values. Let's talk about quality control. So we're going to be explaining the difference between internal quality control and external quality assessment. And I'll also be explaining what quality control really is, so you can have a practical understanding as to what quality control entails in the laboratory. Quality control in the laboratory refers to every procedure that is put in place to ensure reliability, accuracy, and precision of results. So basically, it's everything that you do in the lab that makes you sure that you've done the right thing, that makes you sure that what you've just done, the service you've just done, the test you've just released is actually accurate and that is precise and then it's reliable. So it's all the procedures, like it's a way of you in the lab knowing that yes, what I've done is right, and you can stand on it anywhere, anytime, that you've done the right thing. And if it's taken to another lab, you're sure that your work is precise, your work is accurate, your work is reliable. And quality control is done because we want to be sure of patient safety. So for us to be sure that the results that we're releasing are reliable, accurate, and precise, which also in turn helps the patient, because remember that the results that we give out in the lab is what the clinicians in the ward use to diagnose patients, give them treatment, know if they're going to stop a treatment or not. So it's for patient safety. It's to maintain your accreditation. By accreditation, we have the UCAS accreditation in the UK, and then we have ISO 15189. So what are the types of quality control? We have the internal quality control and the external quality assessments. Internal quality control is usually called the IQC, and external quality assessment is usually called, the abbreviation is EQA. So like the name implies, internal quality control refers to every procedure done internally. So firstly, it's going to be done by a staff of that laboratory. So every procedure that you do internally to ensure that quality is maintained, that we have precise, accurate, and reliable results. Everything that you do within the lab, in the lab, by a member of the staff in the lab, that is internal quality control. Another thing about internal quality control is that it's done on a daily basis. In fact, it is done multiple times a day. So usually at the beginning of the day, after maintenance of the analyzer is done. In some labs it's done every 4 hours, in some labs it's done every 8 hours, depending on where you work, but it is essentially done every day and multiple times a day. So we have a sample that is a quality control sample. So basically, a quality control sample is of known values. The values of the quality control sample is known by we in the lab, and then it is run like how you run a test. So how you run the standard operating protocol for a particular test, you do that same thing for the quality control, for the internal quality control sample, and you should expect to get the same result like the values. Remember, the values are known. So if you're not getting that same result, then mind you, you know that something is wrong. So it means that if the quality control sample is not giving the required results, then it's also telling you that the samples of the patients are not also giving it's not going to be giving the accurate results. So then you know something is wrong, and then you try to troubleshoot it. Internal quality control also detects systemic and random errors in the lab. Apart from the internal quality control samples that are provided by the manufacturers, your laboratory, there's also a form of quality control that we've done in one of the labs that I worked in. So basically, when the phlebotomists collect samples every morning, they just randomly ask any patients, obviously, and get consent from the patients, and basically it's anonymous, and they bring it to the lab. So after we must have done the daily maintenance and run the QC calibration of the sample, of the analyzer, and the analyzer is good to go, before we start running patient sample, we run that drift sample. So we call the sample a drift sample. It's not labeled, we don't know the patient's details, we just use it as a drift, and then we run it across all the analyzers that we have in that lab, and we expect that the results should be similar among the laboratories. laboratory. That's among all analyzers. That's another form of quality control. So if all analyzers are working well, we should have the same set of values amongst all analyzers that we use in the lab. And then we also run it multiple times a day, like every 6 hours we run it, and then the new results we get should be similar to the last, the most recent results. And if there is something that is like we have a difference that's above the reference range, then we know that okay, something is wrong and should be investigated further. When you run a quality control, before you're able to accept it that it's passed or not passed, it's important that you check the Levi-Jennings charts and you interpret it with the Westgard rules, and you only accept it when it has passed. And if maybe checking on the Levi-Jennings chart it hasn't passed, then you know that there is likely a problem, so you cannot approve samples to run on that analyzer. Or if it's a particular analyte, let's say you're in a biochemistry lab and potassium, the Levi-Jennings chart for the potassium hasn't passed, you know that you have to keep that disabled because you do not trust the analyzer. It's not right, so you cannot run patient sample with it. I hope you understand what the concept of internal quality control basically is now. Now let's talk about external quality assessment. So like the name implies, it's done by external bodies. So in the UK we have something called the NECAS. What they do is that they know the sample, they know the values, the concentration, the required values. We in the lab, we do not know it. So they send the same samples to the laboratories or labs, and they know the value. They don't tell you the value. They expect that you run it and you send your result back to them and they compare it. So that way they're also checking to see that, because obviously you're going to run it the way you run the sample. So if your lab report is coming back and the result is not passing, or it's not within the range, then you can tell that something is faulty. And they give you a score, they give you a feedback, they tell you, and that way you can be able to like trace it up from there. So basically it is not done internally by the lab. We do the procedure like we would do a regular sample, but we send the results to these NECAS, and they're the ones that check it to determine if it's passed or not. And also it's also good because they send the same samples to other laboratories as well, so you can also compare that within all the laboratories in the UK. We are sure that there's some form of reproducibility. So you as a patient, you're sure that if you had a test in this lab, in this hospital, and you move from this hospital to another hospital, you know that you're going to get valuable and reproducible result. Also, another thing about the NECAS is that obviously it's not going to be done every day like the internal quality control. It is done either annually, monthly, bi-weekly, it depends. So it's not as frequent as you would have an internal quality control. So I've explained internal quality control and I've explained external quality assessment, and I'm sure you can be able to deduce some differences, but I'll just state some major differences between the IQC and EQA. Firstly, IQC is done by an internal staff, a staff of the lab, while EQA is done by an external staff. So basically, like the name implied, we have the one that's done internally and we have the one that's done externally. So that's one major difference. Another difference is how frequently it is done. IQC, which is internal quality control, is done on a daily basis, most times multiple times a day, while the EQA, external quality assessment, is done periodically, either monthly, quarterly, it depends. Another difference is the sample type. So for IQC, the values are known by the lab. The values that you should be getting is known by the lab. But for EQA, the lab does not know the values. It is unknown. The concentration is unknown, and you only know it after the result is done. Another very important difference is that with IQC, it detects immediate difference. It detects immediate inaccuracy, so that you don't send out wrong results immediately. Like it detects errors that happen immediately, while for the EQA, because this is done obviously in a periodic basis, like monthly or annually or quarterly, it detects like it's a long-term comparison. So they're able to see, okay, within this period of like 6 months, it monitors long-term over time, while the IQC monitors like something immediately it happens, the IQC detects it. Also, the IQC, like I said earlier, is detected or is checked with the Westgard rules on the Levigenis chart, while the EQA is monitored completely different. There's a whole organization for it. So this is basically the difference between the IQC and the EQA. My next video is going to be about audits. We'll be talking about internal and external audit. I hope you're able to learn a thing or two for this video, and I hope you're able to smash it when you get the interview question. Anyways, I'll see you guys in my next video. Bye bye.